While talking about diagnostic studies, we must remember that the true diagnosis is through clinical methods, but the following methods are also used for diagnosing cardiac tamponade patients. The first is echocardiography, which involves two methods. The first is transthoracic, which is non-invasive, and it also consists of two methods. First is two-dimensional echocardiography, about which these steps should be followed, which are right atrial diastolic collapse, right ventricular diastolic collapse, abnormal motion of the interventricular septum, followed by dilated inferior vena cava and then swinging heart. If these steps are involved in 2D echocardiography, then we can diagnose a patient with cardiac tamponade. The second is Doppler echocardiography, which involves the transvalvular flow inside the heart, meaning the right heart will be overfilled and left heart will be underfilled. And the second type of echocardiography is transesophageal echocardiography, which is invasive, and it is necessary in the cases of aortic dissection, free wall rupture of heart, pericardial effusion, or cardiac tamponade after surgery, or any hemorrhagic effusion. The second method is the ECG, meaning the electrocardiography of the heart, in which the cardiac tamponade patients will have an elevated ST segment with depressed PR segment, followed by decreased voltage, and at last electrical alternance, which will be shown in the form of alternating QRS complex. The third is the chest X-ray, in which the cardiac shadow will be enlarged in the shape of a flask or will be seen globular if pericardial effusion is greater than 250 milliliter. But remember that in this case, the lung fields should be clear, which will not be in the case of pulmonary edema or pulmonary edema. The fourth is the CT scan or MRI of the heart, which will show anatomical details of the body with localized effusions, if any, and malignancies or mass lesions in the heart. Another method which is not usually used is cardiac catheterization, in which the diastolic pressure of the pericardium of heart is calculated, which is equal for all the chambers of the heart in the case of cardiac tamponade.